She called patients what? A Winnipeg nurse just had her license stripped. And when you hear why, you will not believe this woman has ever been allowed near any patients. The College of Registered Nurses of Manitoba ruled that she is, quote, ungovernable, meaning they basically said that she's beyond fixing. She lost her license and was ordered to pay $50,000 towards the cost of her own hearing, and she didn't even show up to defend herself. So here's what she's been doing for decades. We're talking complaints that are going way back to 2007. She called junior nurses idiots, stupid. She regularly referred to patients with some of the most vile language that you can imagine. She made racist remarks about Indigenous patients and people of East Indian descent, and she feuded with a family member of a cancer patient. So what took so long for her to get disciplined? But you know what? Here's the one thing that really got me. During COVID, a homeless patient came into the emergency department. He was incontinent and not following mask protocols. Instead of putting him in an available bed, which she had access to, she left him in the waiting room. That decision put everyone in the waiting room at greater risk. A nurse, leaving a sick, vulnerable person to fend for themselves in a waiting room. This wasn't a one-time thing. She had been disciplined 4 times since 2007. She took remedial courses. She made promises to the college and she kept on breaking them. Doctors described her as vindictive, not patient-centered, and said that she made patients feel like they were being grilled when they came in for care. And I'm going to just say it so I make myself crystal clear. A racist nurse should not be a nurse. Full stop. This is a hill that I'm willing to die on. Nursing is built on trust. Patients come to you at their most vulnerable. They're scared, they're in pain, and they deserve dignity regardless of their skin color, their housing status, or anything else. The moment you look at a patient and you see their race before you see their humanity, you have no business being in healthcare. And we already know that Indigenous and Black patients face longer wait times in Winnipeg ERs, and that's been well documented. This isn't just one bad nurse. This is a reminder that racism in healthcare costs people their health and sometimes their lives. She's finally gone after nearly 20 years of complaints. I guess it's better late than never, but it should have never taken that long. Drop me a comment. Do you think that the system moves too slowly on stuff like this?